on In Focus today, talking about Medicare and prescription drug prices. Joining me now, we have Kari Gomez, the owner of Home Instead of Lakeland. Kari, welcome to In Focus.
Thank you.
You know, a Medicare drug negotiation, this could be big savings for Floridians. How do you see that potentially playing out, Kari? What conversations are you having?
So, I've been in senior care for 25 years, and one of the big things that we always see is our clients or our residents are always watching their money. They're always looking at savings. And over the last, I don't know how many years, we've seen it more and more where they're choosing, can I get the care or do I need my medications? If I don't take my medications, then obviously that's going to lead to more care. So the savings would be huge and allow them to continue to live the lives that they really should be living.
And they almost do drug rationing, right?
Yes, I mean, I have heard it. Fortunately, my clients I don't see it directly, but we have plenty of conversations with family members that call in that are looking for care for loved ones. And they're, we hear stories all the time. They're cutting a pill in half, or they're, skipping the evening medication, or they're going to find natural substances that they think might do the same thing. Which may, but not. I'm not a doctor. So, but it's really hard to watch our seniors that have given so much to us having to choose this or that where they shouldn't have to.
So then what's driving the prices of, say, regular insurance that Floridians have to turn to Affordable Care Act and Marketplace to get coverage?
It just feels like everything. I mean, I can't say exactly, what's driving the medication prices, but I feel like, as a business owner, we're feeling it too. We're feeling it from insurance. We're feeling it from wages. We're feeling it from, gas and everything. So I have the luxury, and our employees, we're still earning income, where we look at our senior population, they're pretty locked into what they have. So, something that they were paying whatever for, they're not getting raises. So I think that part of it actually drives more of the burden for our seniors.
So, we sort of alluded to it with Congresswoman Castor in the first segment. But from your perspective, Kari, we have Medicare, but we also have Medicaid. So are they the same or two pieces of the same puzzle? Just tell me what each does and why we have and need these two distinct programs.
Yeah, and I will, let me just say I'm not a Medicare or Medicaid expert. My expertise is seniors. So they are two different programs and they do drive different results. I think relying on folks that are experts to give that answer, I apologize that that's just not my area, but it does cause seniors to have to make different choices in their care and their living environments even.
And tell us then more about Home Instead. Some of our viewers might be very familiar with what you provide at the end of life, but tell us, for those who aren't familiar, tell us about Home Instead of Lakeland.
So Home Instead, and we're a franchise in Lakeland. This office has been here for a little over 12 years. I've been in senior care for 25. Home Instead itself internationally has been around for 30 years. So what we do is we offer care for wherever the senior calls home. So we're not nurses, we're not doctors, we're CNAs and home health aides that are going out into the home and providing that extra care. For example, you may have an individual at home that doesn't drive anymore, but she does very well in her house. So we may go out and help with transportation. We have other individuals that need help with a shower, need help with meal preparation, folks that need reminders to take their meds. Families aren't here local. So that's what we do. We do it in their house. We do it in community environments. We are even in the hospital with our clients because we're just an advocate to make sure that they're getting what they need and what they deserve.
It's something we were also talking about, Kari, is prescription drug prices. Why are these so different country to country. There was this whole thing about those prices being way lower in Canada, for example, but we as Americans were never legally allowed to buy or import those drugs. Where's the disconnect as you see it?
That's a good question. I have a brother that lives in Germany, so I hear it from him all the time that he gets things lower than we do. Where's the disconnect? I don't know. I think there is, I don't know. I guess there's a thing, just businesses are looking at things different. And I think we need to go down to look at what's right and what our population needs, our senior needs, even children, from all different levels, from the simple basic medicine to like a chemotherapy drug. They are ridiculous when you see the prices. So I don't know if it's, just the companies looking for profit. I don't know if it's just the environment driving it. But you hear from all different people. Like I said, I have a family member in another country that talks about, his medicine and what he's able to get compared to what we're able to get. So hopefully it does get addressed.
Yeah. Then what would you think might happen in the healthcare system as a whole if it was just turned on its head in the United States and had it like other countries? That healthcare is completely covered. What would that look like?
Yeah, I think it'd be huge because people wouldn't be choosing, what am I taking? What am I doing? People would be going to the doctors versus ERs or waiting too long. To have a healthy lifestyle is important. And, there are medical interventions that are needed in different people's lives. So I think that would be huge as far as our productivity, our well-being, our health overall, and then lead it into mental health and things like that so we can get the care that we need.
And when you feel some pushback from insurance, how do you deal with that? Maybe just personally, but with also all of your other clients, if you will.
Yeah, I think, personally, I've been fortunate not to have that experience, but when I'm talking to family members and they're sharing frustrations, a big thing for me is just finding community resources that we can point them to. Is there different clinics? Are there different places within Lakeland, within Polk County, for me at least, where they may be able to go and talk to someone in a medical pharmaceutical setting that can say, maybe we can help with that, or maybe there are grants or different funding that you can apply for to get some of that medication at a reduced cost or potentially covered that are being offered through the pharmaceuticals.
So with Home Instead, I'm curious to know about the kind of cooperation and collaboration you have with other local resources.
Well, I'm very blessed that we have a lot of local resources. I actually sit as a president of an organization called Better Living for Seniors, which is a collaboration of over 130 different businesses that are truly focused on seniors and making sure that they have what they need within Polk County, as well as being the co-chair of Age Friendly Lakeland, which is an organization, again, very focused on the Lakeland area and making sure our seniors have what they need, from a senior hub resource center to making sure that businesses are accessible to our seniors, and that things are affordable within the community. So I would say, Polk County definitely has a great connection, and Home Instead is very well established within it.
And a lot of this is about pride as well, right? Because it takes, like going to, say, Second Harvest Food Bank or Goodwill, or seeking that help that you're not used to obtaining. The pride issue comes into play. What is your advice or nudge to seniors watching right now who might need a little help, but don't really feel like they want to go and seek it on their own?
I would say, because I'm guilty of that too for myself. I never want to ask for help, but don't be ashamed. There are so many resources out there, and unfortunately you don't know about them until you need them a lot of times, or you've had a loved one go through it. I tell people all the time, I may not be the person for your mom or your dad or someone, but I will make sure I can connect you to someone that can help. And that's what we really see in our community is the different organizations, the different charities, even through churches, Rath Center. There's so many different groups that are willing to help. And it may take a few phone calls, but the goal is that we're going to find that help for you. Or there may be a need that's driven out of your need, where we created an initiative around making sure we can get that care or something going on in the community because maybe we didn't find the right answer. So sometimes solutions come out of the questions.
And Kari Ann, we're going to lay out some of the resources in our final block coming up. But before you leave us on today's show, just your final takeaway, Kari Ann, your advice to people when it comes to coverage and costs.
I think the biggest thing that I would tell people is don't be afraid to question. You know, if someone's saying, no, you can't get this, help them help you understand why. Ask for resources. If your pharmacy's saying it's this much money, ask them if they have any resources. Reach out to local organizations. Just don't say, okay, I can't afford it. Because 90% of the time, I think there's an answer out there. We just have to ask for it.
Kari Ann, truly, thank you so much for being with us here on In Focus. Come back anytime. And folks, we appreciate you watching. Not done yet. Our final focus is next, right here on Spectrum News. Stay close.